Let's talk about uterine fibroids. Also known as leiomyomas, they are known cancerous growths that develop in the muscular wall of the uterus. They are a common gynecological condition affecting many women during their reproductive years. Uterine fibroids can vary in size, number, and location, and their presence can cause a range of symptoms. They are typically classified based on their location within the uterus. Let's look at the intramural fibroids. These are the most common types and grow within the muscular wall of the uterus. And then there's a submucous fibroid. These grow just underneath the inner lining of the uterus and may protrude into the uterine cavity. Subserous fibroids grow on the outer surface of the uterus, extending outward into the pelvic cavity. And then there are the pedunculated fibroids, which are fibroids that develop on a stalk-like structure either inside or outside the uterus. The exact cause of uterine fibroids is unknown. However, several factors can contribute to their development. Estrogen and progesterone, the two hormones involved in the menstrual cycle, appear to play a role in the growth of uterine fibroids. There may also be genetic predisposition to developing fibroids, as they often run in families. Other factors such as obesity, certain medical conditions such as polycystic ovarian syndrome, and a diet high in red meat and low in fruits and vegetables may increase the risk of uterine fibroids. The presence of uterine fibroids does not always cause symptoms. However, when symptoms do occur, they may include heavy or prolonged menstrual periods, painful menses, pelvic pain or pressure, abdominal bloating or distension, frequent urination or difficulty emptying the bladder, constipation, backache or leg pain, pains during sexual intercourse. The severity and type of symptoms can vary depending on the size, the number, and the location of the fibroids. Diagnosing uterine fibroids typically involves a combination of several methods. The healthcare provider will inquire about the symptoms, the menstrual history, and any relevant medical conditions. A pelvic examination allows the healthcare provider to feel the size and the shape of the uterus. Ultrasound scan is commonly used to visualize the uterus and detect the presence of fibroids. Other imaging techniques such as MRIs or CT scans may be recommended in certain cases. A hysteroscopy can be carried out, and this involves inserting a thin lighted instrument called a hysteroscope through the vagina and the cervix to examine the inside of the uterus. In rare cases, a small sample of tissue may be obtained for further examination, particularly if the fibroid appears atypical or suspicious. The choice of treatment for uterine fibroids depends on several factors, including the severity of symptoms, the size and location of the fibroids, desire for future fertility, and the individual's preference. If fibroids are small, asymptomatic, or not causing significant problem, the healthcare provider may recommend regular monitoring without active treatment. Also, certain medications such as hormonal contraceptives, gonadotropin-releasing hormones agonists, or progestin-releasing intrauterine devices can help manage symptoms or shrink fibroids. Procedures such as uterine artery embolization, myomectomy, which is a surgical removal of fibroids while preserving the uterus, or focused ultrasound surgery may be considered to manage symptoms or to remove fibroids. In cases where symptoms are severe, other treatment options have been unsuccessful, or where the fibroids are causing significant disruption, a hysterectomy, which is the surgical removal of the uterus, might be recommended. This option is typically considered when fertility is no longer desired. As we conclude this segment, it's important to understand that uterine fibroids are common non-cancerous growths that occur in the muscular wall of the uterus. They can cause a range of symptoms, and the appropriate treatment depends on the severity of symptoms, the size and the location of the fibroids, and the individual preferences. Early detection, proper diagnosis, and a discussion with a healthcare provider is important for determining the most suitable treatment approach for each individual.